The phase 2 Keynote 57 study was a multi-cohort study evaluating pembrolizumab monotherapy in patients with high-risk non-muscle-invasive disease unresponsive to BCG. Cohort 1 of the study was focused on patients with the carcinoma in situ component with or without papillary high-risk disease. And the results provided a CR rate, a complete response rate at 3 months, approximating 40%, with the median duration of response of 16 months. About 1/3 of the responders maintained the response at long term, and these results provided the label of pembrolizumab by the US FDA for the treatment of BCG-unresponsive CIS patients. Cohort B of the study, which was the focus of the present abstract, was including the patients without a CIS, with presenting with the PTA or PT1 papillary disease without CIS after centralized review, who were unresponsive again to BCG treatment. The treatment for these patients is still a matter of a huge debate. The design of the study was the same as for the cohort A, so Pembro monotherapy every 3 weeks according to standard schedule for up to 2 years of treatment. Disease assessments were done at 12 weeks interval and 24 weeks, and thereafter up to 5 years in patients who continue treatment without the evidence of high-grade recurrence. The primary endpoint for the cohort B of this study was the 12-month disease-free survival for high-risk disease. Secondary endpoints included disease-free survival for any grade disease, progression-free survival, overall survival, and of course, safety and quality of life outcomes. The primary endpoint of the study, the 12-month disease-free survival for high-risk disease, was provided as 43% rate, which was compelling. Also because the vast majority of the patients who developed a disease, an event in the progression-free survival analysis and in the overall survival analysis, actually, this event was represented by death for any cause and not by disease progression. So a very few disease progression or recurrence event have been recorded after a median follow-up of approximating 45 months, so a pretty decent long-term follow-up. And the safety outcomes were also quite good and confirmed the safety profile of pembrolizumab, which has been already provided in several disease settings, including cohort A of the same study, and quality of life outcomes measured by the functional assessment of cancer therapy scores provided the evidence that the rates and the scores measured at 40-week interval and compared to baseline levels revealed a stability or a slight improvement over time in the vast majority of the patient. And the results, the mean values, the mean scores for the FACT bladder score were stable over time in patients who continue treatment without the evidence of recurrence. So overall, the study provided quite compelling outcomes in a disease for which we do not have a solid benchmark for intravesical therapy, and confirmed to be good and reliable and providing improved or stable quality of life outcome without compromising the quality of life of these patients. Well, I think that it may provide, may revitalize the discussion around the treatment of papillary high-risk disease, BCG-unresponsive disease, because there is a well-established path for drug registration by FDA and drug approval by FDA in CIS refractory disease. And there are a lot of trials ongoing, including patients with CIS, high-risk disease, BCG-unresponsive, but quite a few studies and quite a few evidence from the literature regarding patients without CIS, with a papillary component, for which we do have the suggestion and the guidance for FDA, by the FDA, to provide a randomized study. But the problem is to identify the right benchmark towards which randomizing any new drug in this disease setting. So I think that we may, rediscuss the options for therapy and the the rationale, trial design to set new standard therapies in the near future for this patient population, and maybe expand indication, the current indication for CIS of pembrolizumab.